हेलो एंड वेलकम फ्रेंड्स। स्वागत है आपका एक बार फिर से इन आवर सुपर शॉर्ट summary series. Today we are going to discuss about one of the most deadly viral contagious infection, that is measles. Even till this point, every year almost 20 million people across the globe are estimated to have infection. Among children, it is one of the leading cause of death. The infection is characterized by running nose, conjunctivitis, small red spots on the exposed skin, inside of mouth. Sometimes there are certain spots which are known as Koplik spot. This disease is widespread in Asian countries and African countries. Earlier times this was common in almost all the countries, but now post the development of vaccination, this has been eliminated in the developed countries. But even in developed countries, because of travel and greater connectivity across the globe, now people who are traveling to the countries where measles is still present, they are getting the infection and they are carrying the infection back to the countries. It is one of the most contagious infection. That means if one person is infected in the family, almost everyone who get in contact with that infected person can contract the infection. This virus is harbored in nose and mouth, so all the nasal secretions and oral secretions which you spread all around by sneezing, coughing, while टॉकिंग ऑल्सो, चाहे आप खांसी करते हैं, चाहे कॉफिंग करते हैं, या चाहे आप बातें भी करते हैं, द इन्फेक्शन स्प्रेड्स and it gets suspended in air, what we technically call droplet kind of infection. If you remember, COVID pandemic was also caused by a droplet infection. So droplet infections are like, they are very small particles of liquid which are carrying the virus, and once they are spread by an infected person, as we discussed, the infection person will be carrying the virus in their nose, nasal secretion and oral secretion. So when they cough, sneeze and talk, it will spread in the air, it will stay suspended, and it will be viable even for an hour or two. And when other person, or especially the children, come in contact, they will get infection. Post the exposure, almost 10 to 12 days are required for a patient to show the symptom. And the symptoms starting, there are the common viral infection symptoms like fever होता है, coughing होती है, dry cough जैसे हम कहते हैं, sneezing होती है, watering eyes होता, conjunctivitis is there, and then small red spots start appearing throughout the exposed portion of skin. Mouth के अंदर there are certain spots which are known as Koplik spot. So with these symptoms, the doctors are able to tell in their clinic by physical examination that the person, especially the children, are infected with measles. If we talk about the treatment, usually not much treatment is required beyond adequate hydration. पेशेंट को अच्छे से हाइड्रेट करके रखते हैं, उन्हें उचित समय पे फ्लूइड, पानी, ये तमाम चीज़ें देते हैं. देन पेन रिलीवर्स आर यूज्ड, मोस्टली पैरासीटामोल एंड ibuprofen is used. Then in some cases where children are known to be immunocompromised, or there is a history of patients, even older patients who are immunocompromised, or pregnant women, in those cases we use immunoglobulin as injection, which gives them certain protection and the symptoms are less severe. While the infectivity is very high, the best part is now the science has developed, and from the 1963 only the vaccine is available. It was first discovered by Merck by Maurice Hillman, and post that the vaccine is now available, and even in India this is included in our national immunization program, that is all free and all compulsory for all children. So 2 doses of measles vaccine is given to the children. First is given between the age of 9 to 12 months, while the next dose is given between the age group of 16 to 24 months. यानी कि हम measles की 2 doses देते हैं, पहली 9 से 12 महीने के अंदर, and the second one is given between 16 मंथ्स से लेके 24 मंथ तक. तो अगर वैक्सीनेशन की 2 डोजेज़ पूरी तरह से इस्तेमाल की जाए, जो कि सरकारी अस्पतालों में पूरी तरह से मुफ्त अवेलेबल है, बच्चों को हम मिज़ल्स की ख़तरनाक बीमारी से बचा सकते हैं. फॉर आवर पब्लिक हेल्थ प्रोफेशनल्स, दिस इज़ नोन एज खसरा इन लोकल लैंग्वेज in the Hindi speaking belt, and it is considered to be very deadly. So our responsibility and our requirement is to talk to people that this disease is absolutely preventable, and it is almost every hospital, government hospital as well as private institutions also have got facility of vaccination for measles. Generally ये vaccine available होता है as a dose which also contains it is called MMR, that means measles, mumps and rubella. So there are these 3 infections that can be controlled with single shot of vaccine. As we discussed, this is given to very young children at least 2 times, that is between 9 to 12 months, and the second one between 16 to 24 months. Another important part for public health professionals, especially to educate the parents, is that we make parents aware that if children are having fever, we advise the parents to rest their children so that other children are not infected, because many times between fever to develop and the red spots to come, there is still a gap of couple of days, and in that period also the child is infectious to other children. सो दैट वे अगर बच्चे को बुखार आ रहा है, हमें एज पब्लिक हेल्थ फिजिशियंस लोगों को अवेयर करना चाहिए कि बच्चों को रेस्ट दें, बच्चों को घर में ही रखें, सो दैट अदर चिल्ड्रन आर नॉट इन्फेक्टेड. सो दिस इज़ अ क्विक ओवरव्यू. फॉर डिटेल यू कैन go to the website of WHO or Government of India website. Thanks a lot. Thanks for watching. If you like the channel and like the program, please don't forget to like, share and subscribe to our channel, and also press the bell icon. Thanks a lot.